raise awareness of the violence against health workers. And later on in the session, we're going to play a short video, which will be very distressing. So I'll warn you at the time if you wish to mute or turn away. But a real, I say it's a pleasure to host this meeting, but this is a terrible time that we've got here. There are no doubt other issues that are going to come up, but we're trying to keep this focused on the practical issues of how we in the UK can support our colleagues in Myanmar. Other issues will come up as well, but that's the real focus here. After Professor or the Minister, Zha Wei So, speaks, I'm going to ask a number of parliamentarians if they want to raise questions. I'm going to turn first to Lord Arodazi, who is a great friend of people in Myanmar, work there a great deal, and is joining us, in fact, from Armenia at the moment, where they are commemorating an appalling genocide of 100 years ago, which has an awful resonance, doesn't it, for our meeting at the moment. I will then turn to Sarah Champion, who is chair of the International Development Committee, but also ask other parliamentarians if they want to come in. Then you've got a briefing which I think has got an agenda on it. We will then turn to Sonny Young, who will tell us about what the diaspora are doing here. Marcus Wooden, who will talk about what British organisations are doing, and Dr. Thin Lang, who's going to say a bit more reflections on the value of continued UK support. We're then going to open it again for further questions, and at the end we will give that will take about 25 minutes, something like that. And at the end we will give Professor Minister Zha Wei So the opportunity to have the final word. And there'll be, I hope, quite a lot of time for questions. This will be a hard meeting for me to chair, may I just say. I'm not seeking your sympathy, but there's a lot of people here, which is great. If you want to speak, please put up your hand, and you'll see the hand is under the, if you find the list at the bottom, you'll see the reactions. Under reactions, put up your hand, and we'll bring you in at some point. In the meantime, please keep yourself muted. Except when you're speaking, but you can unmute yourself. So it's that sort of format. I think those are my introductory remarks. No, they're not quite. I've got one other thing that Nicole would remind me, is we are recording this meeting. So please be aware of that if you have any concerns about that. And people who've joined in the last 2 minutes may not have got the briefing, but Nicole, I know, is sending it to you anyway. I think those are the things that I meant to say at the beginning in terms of the business terms, as it were. So on that note, it gives me enormous pleasure to introduce Professor Zha Wei So, who, as I said at the beginning, is the Minister of Health in the National Unity Government, formed recently by the CRPH, which represents MPs democratically elected. Professor, can I invite you to address us?
Thank you very much, Lord Christie and Lord Darcy. Good morning, ladies and gentlemen from the United Kingdom, and of course, good afternoon for Myanmar. Now we're 4 p.m. in Myanmar time. It is a great honor to be a part of the today program, and thank you so much for organizing all-party parliamentary group on global health, and that for organizing and inviting me. And then also, this is very important event for Myanmar. Actually, I'm very much excited to talk and then also discuss with you for the future Myanmar healthcare. And first of all, I would like to appreciate and acknowledge actually you have been supporting us to Myanmar since the time of the coup. And then also you having and helping us for Myanmar, I mean, many years. I'm aware that, the first day, and then after that, Lord Darcy had, read a paper about us. And then that's why we would like to appreciate, and then also thanks for your support, and then your comment on the international paper. I believe that I think you all know about Myanmar, and then I think you are following the Myanmar 2021 resolution. I don't want to mention all these things in detail. I don't want to make a long story. I think even since the very first day of the coup, ordinary people, all walks of life, have expressed their reject and regret of the military coup and military council by non-violent protests, street protests, and then civil disobedient movement. We have been protesting every day, each and every second and minutes now, 85 days now, to stop the coup, to release and reinstatement of our president, State Councillor Aung San Suu Kyi, and leader, and also political prisoner, and to recognize the 2020 general election result, and to restore the civil government, and to abolish the 2008 constitution, actually that's written by the military juncture to continue and to rule Myanmar for life. And actually, this is the data today. More than 800 people has been killed by the military and security forces, and more than 3,500 people has been detained since 1st February. The sniper, they shoot in head and chest, and then targeted and very systematically attacking and killing us, an unprotester. Actually, that toll has been increasing day by day because of the brutal crackdown. Even they used a grenade to kill us. And throughout this time, all healthcare professionals being experienced much hardship, and many others have to risk our safety and life and well-being, both financial, physical, and emotional. Healthcare professionals take part in the CDM. General practitioners and supporters from the private sector could provide much of the basic health needs of our people. However, the military simply would not let us do so. Actually, I myself, I started a CDM on 8th of February. But actually, I have been preparing for the, that we know that if we do a CDM, there will be an impact to the people, healthcare. That's why we are preparing. At that time, actually, I was vice chairperson for the COVID-19 control and management in Yangon. That's why I have to prepare for the COVID-19. If there's a outbreak, I will prepare for the management and the process and program. The same thing I have been working with the general practitioner for whole country, and then also I have been working with the private sector and private healthcare provider from the whole country, and to get subsidized healthcare, and also set up the charity hospital and charity clinics. At that time, within 5 days, 6 days, we have set up the 6 charity clinics and hospital in Yangon. Actually, the healthcare provider, they would not even let military, they would not even let us help those the wounded during peaceful protests. The juncture troops have, in fact, specially targeted healthcare professionals and health facility. Recently, they have detained my colleagues. Actually, I think Lord Darcy know him. He's an emergency specialist and professor of emergency care, who has been helping masses of the casualty at Yangon General Hospital. Earlier in this month, they detained a professor of orthopedics and then also emergency consultant surgeon on the run after having the injured in mass shooting, as they showed no hesitation in detaining prominent doctors and national repute. One could only imagine what they would have done to our younger, less well-known colleagues. As things now stand, we are having to organize treatment in secret facilities. And their action have devastated primary and secondary care. They have quartered troops in a hospital. They have amended the penal code to make it a criminal offense to make comments against the juncture or in favor of CDM. They have issued arrest warrant against the healthcare professional, expanding the list every day, including myself. And then also, I have been hiding and then also tried to get a safe place. And then also my family, I think maybe you're aware that they burned my house, tried to burn my house. And then these things they have been doing. And now we got this is the list today. There's 97 health workers were arrested, 32 health workers were injured, and 10 health workers were killed, including one of my students. They shoot him at the chest and then he was killed. And hospital were raided and hospital were occupied. There's 49 hospitals were raided and occupied. Another major concern in third wave of COVID-19, I mentioned because I'm very much aware of the COVID-19. Now India and Thailand, they're increasing the number. And that's why we are very much concerned and very much worried about the third wave of COVID-19 in Myanmar. The coup has disseminated the vaccination program that have been running comparatively smoothly in comparison with other neighbor countries. Actually, Myanmar is one of the first country getting an vaccine injection in Asia. And we have to, we would like to, thanks to the, she put a lot input to the COVID-19, Excellency Aung San Suu Kyi. The failure of program is a grave concern, not only for the people of Myanmar, but also for the entire Southeast Asia region and indeed the world. And since then, Myanmar need help. In addition to unprecedented disaster of the COVID-19 pandemic, we face a man-made disaster of epic proportion. Large-scale displacement of the people and taking place both internally and to neighboring country. Actually, now we have calculated number, 500,000 internally displaced people will be there. We call for humanitarian assistance for those displaced persons, especially in the border region, with support from the international community, UN organization, NGO, donor nation. We will also need for Gavi, the Vaccine Alliance, to make vaccination accessible to our people once again. I'd like to a little bit explain about the COVID-19 injection and COVID-19 vaccination. Actually, a military juncture and military council, they have been trying to give injection, actually, since after the coup. But actually, people, they didn't turn up because this is the public CDM, what they are doing. I mean, Myanmar protester and then Myanmar public communities be doing, because they are saying, release the Aung San Suu Kyi. They call Mesu. Without releasing her, they are not getting an injection. That is what they said. And that's why they cannot give injection to the people for the COVID-19. And I also like to update you about the National Unity Government. Actually, National Unity Government was formed and announced by the CRPH committee representing the actually Parliament. on the 16th of April 2021. CRPH has been trying and working to get legitimacy because they are an elected person, and then to form a national unity government. We have been having a meeting, many meetings with ethnic armed group, ethnic organization, ethnic parties, and then also civil organization, and then general strike committee to form a national unity government. Finally, we come up with a national unity government on 16th of April. Our aims and objectives of the government is to eradicate the dictatorship, to abolish the 2008 constitution, and to build the Federal Democracy Union. And the Ministry of Health of the National Unity Government has announced policy, strategy, and immediate healthcare plan. We have announced that. We would like to share with you to look at where you can help and support in this plan. In this plan, we included primary health care. I mean, of course, we have liberated area, and then also there's a military oppression area. There's a two area we have to think of for the health care. And also we included our public partnership with the general practitioner and public-private partnership with the private hospital all over the Myanmar. And also emergency health care services in Myanmar. And also we included the telemedicine. Actually, we have done some pilot project telemedicine during the COVID-19 management, where I working in the COVID-19 control. And also we included in this, our immediate healthcare plan, COVID vaccination. There's a capacity and capability and also possibility, especially in the border area. I mean, Chin, Kachin, Kaya, and Kayin, where we have liberated area and where ethnic armed groups and ethnic organizations are working. And also we put that humanitarian assistance aids in our healthcare plan. And I would like to say thanks to all the parliamentarian, and then also all the participants and all the attendees in this meeting. Thank you so much. Please help us. Please support us. Please recognize us to stop the killing, to get humanitarian support to poor Myanmar people. Actually, we use a three-finger salute as a symbol of our revolution, Spring Revolution. I would like to end it up with that salute. We must win. Thank you so much. Thank you.
Thank you so much, Minister. And for people who only joined very recently, this is Professor Zhao Wei So, who is the Minister of Health in the National Unity Government. I'm now going to ask parliamentarians to make a comment or to ask a question. And I've got four listed, and I'm going to take them in this order, if I may. I'll start with Lord Ara Darzi, and then go to Sarah Champion, and then Jack Mcconnell, and then Lindsay Northover. If there are other parliamentarians who'd like to say something at this stage, there will be opportunities later on. Please put up your hand and I'll try and find you. We have got 200 on the list, so I'm finding it a little difficult to do that. But let me go straight away at this point to Sarah Champion, who is, for your information, Minister, she is the chair of the International Development Committee in the House of Commons, and therefore very important role to play in keeping the government to account on development. So Sarah, may I turn to you?
Thank you very much. Minister, that was incredibly powerful, and I'm just so grateful that you come to speak to us today, because one of the problems we have is getting information of what's actually happening on the ground. My question for you is a simple one, but you might not know the answer. Why do you think they're targeting health workers in this appalling way? What is their strategy for doing that?
I think you know that actually medical personnel and doctors and nurses, previous government, we also criticized to the government, you know, we give many input, but actually because of the partial democracy we have for about 5-6 years with the, you know, the Aung San Suu Kyi government, and we are expecting, and we know that we are having a more, healthcare system will be better in future. And that's why when we have coup and doctors and nurses and healthcare personnel from Myanmar, we are very much concerned. That's why we started protesting. And then also we started, CDM. But CDM is very much, successful, and then stop the mechanism, and then they cannot rule the military. Actually, if you compare with 1988 revolution, and now 2021 revolution is quite different. Actually, in 88 revolution, they can rule the country very quickly. Now they cannot rule it because of the protests, peaceful protests, and CDM. That's why I think they are targeting and aiming, and then also very systematically attacking on us. Thank you so much. Thank you.
And I admire you even more, Minister, and please be assured that my committee will do everything it can to keep on drawing international attention and hopefully international support to what you're going through. No one should have to go through that. Thank you.
Thank you. Thank you. We will do that. Thank you so much for your support.
Thank you very much indeed, Sarah. I actually, having said I'd start with Ara, I started with you, but let me then turn to Ara. I hope you're still with us, Ara, and not rushing for a plane. So Lord Ara Darzi, if you'd like to comment.
Thank you very much, Nigel, my lords, my colleagues from the other house. Great pleasure to be here. But let me just start by firstly saying, Professor Sao Yesu, great to see you. You're a brave man. We've always admired you, but you managed to get out and hold a leadership position. Keep well, keep safe. And as you know, Britain has always been the friend of Myanmar, and all of us in this room have made and care for Myanmar. So what we call Burma, by the way. I think from the colleagues in the room, my association with Burma started nearly a decade ago when I was asked to help on reinvigoration of Rangoon General Hospital, where Dao Su, what we call Aung San Suu Kyi's mother, was a nurse. And she was a formidable nurse in that institution. And I did declare an interest. I'm a trustee of the Rangoon General Development Fund, which is a British charity, and we've raised money to develop the hospital. I was also involved in the Rakhine reconciliation process, which followed Kofi Annan, and I was part of a committee that failed at the time, but you know, huge amount of work went into Rakhine. And about 2019, I had the grace of Aung San Suu Kyi in giving the pardon of the 2 Rohingya journalists. So I was the guy who ended up in front of the prison waiting for their release. And Burma and Britain have a long history. Some of it is good, some of it is bad, some of it is not talked about. But we are Burmese look up to us, and what's happened to the doctors and nurses that we've talked about. At the beginning of this coup, I received some pictures which were validated. They were sent to me in confidence. They were validated, and some early stories about targeting physicians and nurses. And Professor Yaozu clearly said why, because they are the first who stood up. In actual fact, it could be the railway, the train drivers or railway people were the second group that came out protesting. And the problem with the junta, with the military, is they will destroy any institution, and certainly the educated group like the physicians, but also the academics, by the way. I mean, if they had, Martin Smith once said to me, if they have the choice, they will convert universities to kindergartens. That's the regime that we are dealing with. I think the challenges facing us now, although not, started the same way in 1988 with the coup, but I think, as mentioned earlier, we're really talking about a different Burma now. We're talking about what we call the Generation Z. The young will not accept this. And also some other thing to tell you about the army, which again I've learned in recent times, is, the junta, the military leaders, that's a small group of the whole army. The whole army is not what we perceive it to be. And, at some stage, divisions will start. We saw a couple of senior generals who stepped or at least abdicated. So the cracks are starting up. And I think Burma is looking to us all, what we can do to help it. And if you want to read a little bit more about the doctors and nurses, there's a BMJ article that I wrote about, which I'm happy to share in the message box. But I've taken enough time. I know there are so many people who want to talk about this important subject. So back to you, Nigel.
Thank you very much indeed, Ara, for those reflections. Let's then turn. I've got two more parliamentarians, and then we'll go back to the main agenda. So first, I'm going to turn to Lord Jack Mcconnell, who has a great record in development, former First Minister of Scotland. And Jack, I think you're still with us. May I hand over the microphone to you?
Thank you very much, Nigel, and thank you very much, Minister, for an excellent presentation. I think it would be fair to say that there is an incredible solidarity for you and your colleagues and everybody in Myanmar at the moment in the House of Lords, across all parties, many voices speaking out, and all keen to learn more about what we can do to help and support you at this difficult time. I had a very specific question, which results from engagement that I had with a number of groups in Myanmar, including the Myanmar All Stars, a youth group who support young people affected by HIV/AIDS. And in my conversations with them over the years, one of the big worries they had about any major crisis like this would be an inconsistent or a suspension of supply of life-saving drugs, for example, antiretrovirals for HIV/AIDS. And I just wondered, beyond all of the other really important things that you have mentioned, if there have been issues in terms of maintaining the supply of life-saving drugs, not just for people affected by HIV/AIDS, but for, of course, many, many other conditions as well. Has the breakdown in relations, obviously, between those responsible for the coup and the international community affected supplies and also delivery on the ground for these kind of conditions?
Thank you so much for your support. And actually, we included in our immediate healthcare plan for the 3 diseases program. That what I mentioned, primary healthcare and also partnership program included. I'm very much aware that since even we have COVID-19, pandemic and outbreak in Myanmar, that is one of the issue that we have to solve for the HIV, TB, and malaria. Drugs and to get treatment for them. That's why, of course, that damage, also affect to that program. And I have bilateral and multilateral discussion already done with some of the organizations that they have been doing in Myanmar last 1.5 months, and then immediate that discussion we have done. That's why actually they have been continuing their program but they are not talking, and then they are not having a work with the military, but they working on ground level, and then we call township level. Actually, they continue working, and then also we already discussed and then have a meeting with them, and then we are going to include that program in our immediate healthcare plan. I'm sure, I think we can continue and we can get a proper management for that. That's what we are doing and what we are going to do. And I would like to let you know that primary healthcare, midwife, PHS1, PHS2, I mean, healthcare workers from the rural and then also urban area, actually they have been working. Even though they are doing the CDM, they stop working with the government, but they working their own with the collaboration with the private sector and also UN organization. That's what we are doing now. Thank you so much.
Thank you very much indeed. Let me then just turn to one final parliamentarian before we go back to the main agenda, and that's Baroness Lindsay Northover, who's indeed a former Minister of Development. Lindsay, would you like to say something, ask a question or make a comment?
Well, thank you very much indeed. And like my parliamentary colleagues, if I can pay tribute to your bravery and those of your colleagues in this situation, we realise what a risk you're placing yourself in, and we really do pay tribute to that. And you certainly have support from the UK Parliament. Those who've just been speaking to you come from all parties and both houses of Parliament. So I hope that you can see the level of support in the UK Parliament. And of course, Aradazi has played a major role in helping to develop your healthcare system. And it's very interesting to hear from him in terms of how he sees things also going forward, and his comment about young people now not accepting what's happening in Myanmar at the moment, and that they will insist on change. Obviously, they themselves are at risk, and we've seen that in other areas. The situation in Hong Kong is not encouraging. And we need to work together to ensure that Myanmar doesn't go down the same sort of route. Clearly, we've got to try to do our best to come through this period in the way that you have laid out, and to rebuild Myanmar in an inclusive way with all communities. And I wondered if you might be able to comment on that. But I also wonder if you could say a little more about what actions you feel that we might take. I think that I hear what you say about COVID. Clearly, the pandemic worldwide shows how globally interlinked we all are, and that what happens in one country very soon affects others. And we can see that from Brazil, from India, from South Africa, also, of course, what's happened in Europe. And so, therefore, I would hope that our government and other governments would see that conflict is not a good situation for fighting something like COVID, and so that global self-interest, if nothing else, means that we've got to address what's happening in Myanmar. But I wondered if the United Kingdom has placed sanctions which are aimed at trying to hit the military in this regard. I wondered whether you've got any other thoughts as to what the United Kingdom should be doing. But thank you very much indeed for the work that you're doing. And again, I pay tribute to your bravery and that of your colleagues.
Thank you so much. Thank you so much. Actually, this meeting, and then also your words, and then also Lords, Darcy, and everybody is saying that make us strong and free to continue and to fight for the democracy and freedom, and also justice for Myanmar. And thank you so much. And also not only me, I'm sure, but also Myanmar people, and then young generation, Generation Z, they will be very happy, and that support to them, and then make them strong. Thank you so much. Actually, regarding with the all-inclusiveness in Myanmar, actually we have been trying all our possibility. Even we reach out to the Rohingya, we already have discussion and working, and then also having a meeting with them, and also Rakhine and Sham. Actually, everybody are involved. And then before forming the National Unity Government, actually we already have some agreement, but some because of some condition, and then some prior things, history, we cannot make it everything announced and declarable and then include in the NUG. But I'm sure in future National Unity Government will be representative of all the people from Myanmar, I'm sure. And that is a representative what we are doing. Actually, we don't have much conflicts with them, because we are the same aims and objectives: humanity, human rights, and then also justice, and then also against the war crime, murderer. That's why we are the same. That's why we all are united in that way. That's why we are calling National Unity Government. And then also regarding with the actually what we need is, because we need communication, we need internet access. Without having that, very difficult to work for the healthcare. That's why I put that project in our plan. Immediate healthcare plan. We need telemedicine because of the a lot difficulty, and then also remote areas and things. That's why we need telemedicine. Actually, we have some project and program that we learn, like Luxembourg. Actually, they have a telemedicine program in the in Afghanistan and Bangladesh and in Philippines. The same types of telemedicine we would like to set up in Myanmar, and then also both a liberated area and then also oppressed area. And regarding with the COVID-19, actually we already done the research and study last 1.5 months. Actually, in my military support group, there's people who is doing a CDM. They are expert in in the COVID-19 injection. Actually, they wrote and they proposed the whole country proposal. Now they are with me. That's why I'm quite confident to give injection in those areas, especially border area, Chin, Kayin, and Kaya, where there's a border crossing, and then that can prevent the spreading of the diseases. And then also, if we get injection, if we get a vaccine, definitely we can manage to give injection in those areas, because these are the area where we have ethnic group and then ethnic group, and also CDM doctors and nurses are now they displaced to those areas. That's why, and then also we have some infrastructure there, and that's why I think I'm sure we can give injection, COVID-19 injection to them. That can help Myanmar, that can help displaced people, and that can help the neighboring country. Thank you so much. Thanks.
Thank you very much indeed, Minister. I'm going to take one more parliamentarian, Baroness Sheila Hollins, who some people will know as a former president of the Royal College of Psychiatrists. And Sheila, if you could be relatively brief on your
I will be very brief because I have to apologise for having missed almost all of the presentations because of another meeting. I was just interested that in your website, there was no mention of mental health. And I know that the Royal College of Psychiatrists has been working through its volunteer programme in Myanmar for some years now, and wondered whether you were in contact with that programme. Thank you.
Thank you so much. Actually, I'm a rector of the University of Medicine 1. Maybe you aware that. Since the rector of the University of Medicine 1, I'm working, we have relationship with the RC side. And then also we have a very good, communication, and then also exchange program. And then also some of the Myanmar diaspora from the RC side, they've been working with us, since then, 2014, 15. And then that's why we have very good relationship. And then also I have a very strong support from the Myanmar diaspora from the RC side in my advisory group for the Ministry of Health National Unity Government. Actually, some of them are my student, and that's why we are together working, and actually we are together fighting to the military juncture. And I'm sure we can have a lot of project and program regarding with the mental health, because now Myanmar people, they need that kind of support, a lot. This is a disaster, and then man-made disaster, and then also killing, and then I think maybe you feel my student, we lost. That's why how we feel. Thank you so much.
Thank you so much. You've done a very good introduction there to talking about the partnership bit, which is what we'll now go on to talk about. Big issue here, of course, for us as parliamentarians and others, is to make sure that the FCDO continues its support for these partnerships. But we're going to take 3 5-minute inputs now. First of all, from Dr. Sunny Yong, who's giving an overview of the support that is being channeled from the UK. I should say that Sunny is a member of the Myanmar diaspora, and that actually I've been told there are 700 people in that diaspora working in the NHS in the UK, which is an extraordinarily large number. I had no idea that it was that large. So we're very grateful to them. But Sunny, at that point, can I hand over to you?
Thank you very much, Nigel. I hope you can hear me.
Yes.
Right. My task today is to provide an overview of the support to the Myanmar medical community from the UK medical community, which includes the 750 Myanmar medical diaspora. However, to illustrate these activities, please allow me to tell you a story about a young female GP in Mandalay and how the recent political crisis has affected her both professionally and personally. Dr. A, as we all call her, works as a private GP in her own clinic in Mandalay. Life is busy with her 2 young children and work, but Dr. A had aspirations to develop as a GP, and in 2016, she applied for the Royal College of General Practitioners Travel Scholarship. She was successful in her application.
Currently unmuted, Alt+A.
And it made it possible for her to visit the UK for 3 weeks to study UK general practice. During a visit, she was able to spend time with many GPs in the practices around the UK and develop strong friendships. The visit enthused and encouraged her to participate in the 1-year Myanmar GP Quality Improvement Training Program in 2018, organized by the RCGP. Excuse me. Through a series of 4 to 5 day workshops, she acquired the tools and the skills to make changes to her practice and improve the care to her patients.
Currently unmuted, Alt+A button to act.
The course also provided her with the confidence to apply for the Masters in Family Medicine program at Edinburgh University. But the coup in February has brought drastic changes to both her professional and private life. Now, in addition to working in her own private GP clinic, she has volunteered to work in a charity clinic that provides medical cover for the protest. So now she finds herself in an ambulance ready to care for people injured in these protests. However, she finds that her years of experience as a GP has not provided her with the skills to manage rubber bullet injuries, gunshot wounds, and tear gas injuries. To support the new clinical skills required by Dr. A and my GP colleagues, the UK medical partners, which include many Royal Medical Colleges and universities, supported by charities such as THET and World Extreme Medicine, have organized webinars. These webinars are by UK medical specialists on topics such as management of traumatic injuries, including gunshot wounds, management of mass casualty incidents, and safe transfer of patients. This tells a story about the situation that is ongoing in Myanmar. We have also made sure that Dr. A and her colleagues have access to Myanmar Clinical Guidelines website. This website has recently been developed by UK medical partners following the coup to meet the current needs of the Myanmar doctors on the ground. The guidelines mainly cover emergency care of trauma and will also include short YouTube video clips on practical skills translated by the Myanmar diaspora. The charity clinic where Dr. A works has been visited by the military and the police, and some days they have been unable to carry out their work for fear of intimidation and arrest. So before she sets off every day for a shift at the charity clinic, there is a moment of hesitation as fear overtakes her, but she still goes out and does a shift. When we meet with her and her colleagues, the one request they have made is that should they be arrested by the military, to promise that we, the UK medical partners, will do everything to make sure that they are not forgotten. Colleagues in Myanmar want us not just to hear their stories and provide remote clinical guidance, but also be their advocates and condemn the violations of medical neutrality. To this end, we have produced a statement condemning the violation of medical neutrality, which has been adopted by the Academy of Royal Medical Colleges and the British Medical Association. Another way to keep them safe is to keep Dr. A and her colleagues' stories alive and high on the agenda of not just the UK medical community, but the UK media. We have published articles in the British Medical Journal, the British Journal of General Practice, and the Guardian newspapers. We have also done interviews on the BBC to highlight the dangers faced by healthcare workers in Myanmar going about their daily work. From our regular meetings with Dr. A and her colleagues, we are aware that the Myanmar population is unable to access government hospitals at present, and they are having to depend, as Professor Zoe So has said, on private GPs and charity clinics. Midwives and health visitors are still working and deliveries are being done, but patients needing investigations such as x-rays and blood tests that would normally be free in the government hospitals are having to be paid for either by the patient or subsidized by the charity clinic. The 750 strong Myanmar medical diaspora community in the UK, together with their medical friends and colleagues, and organizations such as the Brighter Future Foundation, have raised funds to support ongoing healthcare in Myanmar. In addition, the medical community is exploring
currently unmuted. Alt plus A button to activate. Press
aid and other international donors. By continuing to engage with us, doctors in Myanmar know that they are putting themselves in danger. but their hope and determination for a better future, which they have glimpsed over the last few years, is greater than their fears. As their colleagues and friends, we in the UK medical community want to do everything we can to show solidarity, and will continue to find ways to support them. We all feel that empathy is incomplete when it does not lead to action and an attempt to help. Thank you.
Thank you very much indeed. Can I just ask Jean Moose if she would possibly leave the conference and come back in? So, because it keeps coming into our I think everyone's hearing some statements from her phone or her screen.
Mute, currently unmuted, Alt+A button to act.
That seems to be the problem that I'm having. Okay, we've got two more people to just give us just brief insights into what's happening in terms of the partnerships in particular. And then we're going to throw...
Alert, Harry Jones. Alert, Harry has left the meeting.
Right, am I unmuted at the moment?
Yes, we can hear you.
Sorry, I think I'm unmuted now. Good. So we'll take two more inputs and then we'll have some space for questions. I then want to bring in Ben Sims, who's also going to talk about the support from the FCDO. And can I ask people to be relatively brief because we've got about another 35 minutes to go. Do put lots of comments in the chat, please. And if you want to ask questions, please raise your hand. You'll find the button where to do that. So on that note, can I then turn to Marcus Wooten and a case study of how the UK health community is responding. So this is from the British side, as it were, and from the Royal College of Paediatrics. Marcus, over to you.
Hi, thanks very much indeed. I hope you can all see my screen. Is that right? You can hope you can see my screen? Right, so it's a real privilege to speak to you all today on behalf of our partnership and the doctors and nurses who have worked with us. There is difficulty in adequately describing the depths of the partnership that exists between the UK health institutions and our Myanmar counterparts. So whilst I will focus on our college's partnership with the Myanmar Paediatric Society, I want to pay tribute as well to the many similar relationships that have evolved across many years over the health sector. For all of us, the Myanmar coup is not some terrible thing happening in some faraway place. For us, this is a disaster that has befallen our partners, our colleagues, and our friends. RCPCH has worked with the Myanmar Paediatric Society since 2016, initially through support from THET and DFID before developing our ongoing work with outstanding support from UNICEF. Prior to the coup, our programme had supported 21 hospitals across 4 regions and had delivered significant reductions in mortality, measurable improvements in the standards and consistency of care, and nationwide improvements through close working with our colleagues and partners. We were delighted to receive a British Medical Journal Award for this work. We believe this provides a strong argument for support of Myanmar's health system through partnerships such as ours, and this type of targeted support through UK aid more generally. The strong partnerships and experience of Myanmar within the UK health community had provided the foundation for this new collaborative working. And so since the 1st of February, we've witnessed a rapid and complex health system deterioration. Government hospitals, which form the bulk of the country's hospital network, have essentially stopped functioning, leading to an absolutely extraordinary fall in admissions. Healthcare is now being provided, as we've heard, through a complex system of pop-up clinics, private clinics, many of which have waived their fees. And the fragmented nature of this means it's not always possible to access guidelines and to ask for a specialist opinion, and lives are being lost as a result. Thanks to the convening power of THET, we have come together as a health community to develop a low bandwidth website with simple clinical guidance for common conditions. The conditions are provided in a list form with a simple flowchart, as you can see on the right-hand side. And the address for this is in your packs. Despite being only up for a few weeks, the website now has nearly 1,000 active users, And with UNICEF, RCPCH has continued to upgrade our mobile phone app, which provides specialist paediatric guidance to those treating children. Due to the health system fragmentation, we also know that many doctors and nurses are struggling to access specialist advice. And so we're offering daily Zoom calls with UK-based Burmese-speaking clinical specialists, which are open to any doctor and nurse in Myanmar who wants advice. Within this, we're also offering mental health first aid support for clinicians. The deliberate internet flow restrictions mean it's very hard currently for clinicians to access this service. And we see them trying to log on to the call before quickly falling away again. And prior to the coup, online events we ran would often have more than 100 participants. So we're not asking for a new system to be put up, we're asking for the old system to be reinstated. And this leads me on to the next part. Aside from trying to maintain the health system, our colleagues are also having to deal with a huge increase in cases of trauma. There's a whole generation of doctors and nurses who've never dealt with gunshot wounds and trauma on this scale. And so we worked with colleagues in Southampton and Cambridge to record social media friendly videos of first aid in gunshot wounds and other trauma settings, which can be shared via phone and online. So what do we ask? We ask for the UK to work multilaterally to actively engage with Myanmar. The international retreat from Myanmar that followed the crises in 1988 and 2007 provide crystal clear examples of the terrible consequences that come from international isolation. We would argue that working through broad civic society can act as an effective counterbalance, and this should include medical societies. On a practical level, we ask you to work with others, including the telecoms companies, to ensure the rights of the Burmese people to access the internet and communicate with the outside world. Our support currently to them hangs by a fibre optic thread. And finally, and most urgently, we ask you, our elected representatives, to do all you can to protect the Burmese doctors and nurses. In some cases, that might mean supporting asylum applications, but in a wider medical context, medical neutrality could not be more important. We ask you to encourage the work through international bodies, including the UN Security Council, to uphold international law and apply maximum pressure to those who have assumed power. The plight of Burma's doctors and nurses and the population they serve could not be more urgent. Thank you very much.
Thank you very much indeed, Marcus, for that impressive story, but also for your plea at the end there as well, which we do need to make sure we come back to. Let me on that note then turn to Dr. Thin Thin Liang for her reflections on the value of continued UK support. And I do remind people, if they want to ask a question or make a comment, do raise your hand in the participants file. So thank you, Marcus, and over to you, Thin Thin.
Good morning, Lord, ladies, right honourable members of the Parliament, colleagues and friends. I would like to first thank Ben and all my colleagues at TED who have shown tremendous support since the 1st of February, and also for organising this event together with Nigel and all party parliamentary global health section. Second of all, we have heard from Sunny and Marcus how the medical community in the UK has unanimously shown the support for all the colleagues and friends in Myanmar through various ways. So we've heard advocacy through communications and medias, publishing through different medical and non-medical journals, and academic and professional support through the website and through webinars, and also through the telecommunication clinical virtual support sections. And also the fundraising, diaspora have been raising funds to support the charity clinics and supporting the basic essential needs for people who have been displaced and forced to flee because of the arrest warrants. And finally, the moral support that our colleagues have shown through social media, for example, posting the unique revolutionary symbol, 3 fingers symbols on the social medias, that all these things matter to all the healthcare professionals in Myanmar. Without those, the lives and the arrest and the tortures that have been suffered by the healthcare professionals in Myanmar could have been gone forgotten for no benefit. So Myanmar Revolution needs you, and Myanmar Revolution needs the international community to stand up with all of us. Myanmar already have been faced with tremendous challenges from the COVID-19, even before the coup. So you can agree with me that at this present time, Myanmar is on the brink of the face of the failed state. So we people of Myanmar cannot fight this alone. We need your support. And I call for your support for calling the military to immediately stop the violence against the people, including the healthcare professionals, and also by advocating the UK government to find a way to help the humanitarian assistance in the people in the border area who have been displaced internally. And thirdly, for restoring the uninterrupted access of telecommunications to Myanmar people, because this is the basic human rights and all our activities are depending on it. And lastly, what I want to remind all of us is that the military council is undermining the democracy values and abusing human rights and violating the dignity of the people of Myanmar. And no one in the world will be safe unless everyone is safe. In this phase of the world's most terrible pandemic, COVID-19, we have to come together to restore democracy and also to bring the COVID-19 anti-COVID-19 measures in Myanmar to normalcy. So please help us and please help people of Myanmar to win this fight. And our victory is your victory and the world victory to restore democracy and fight against COVID-19. Thank you all.
Thank you so much, Thin Thin, for those powerful words, which I'm sure we all share and wish to respond to from the UK. I'm going to bring in Nikki Williams, who I think has got her hand up. I think she's the only person. I'm then going to come to Ben. And Ben, at that point, you might want to introduce the poem and the short video that you wanted to show. But let me go first to Nikki.
No, Nigel, that was a clap to Thin, not a hand up, but thank you.
Oh, that was a clap. Oh, sorry, I'm not very good at this. I can't see any hands up. So at that point, Ben, I'm going to go to, I'm going to come to you, Ben. And if you'd like to just introduce the video. Can I say this video is very upsetting? I haven't seen it, but I know it's very upsetting. So it'll be upsetting to all of us. You may or may not want to watch it. It's only 3 minutes, but Ben, let me turn to you.
Thank you so much. And may I pay tribute to Jim Brockbank and Maria Teresa Heather in particular for the work they did producing this video.
Poem for Myanmar. He stands at the front of the protesters' parade in a builder's hat with a shield, homemade. Blood type and next of kin displayed on his arm at the ready, should he come to harm. Sighted down the barrel of the sniper's gun, he falls. Blood seeps into the mud of the street. He lies, steeped in the courage of youth. A citizen journalist captures the truth. From Yangon to Darway and Mandalay, what am I if I look away? Soldiers sweep through neighbourhood streets where brutality and terror meet. Residents urge the hunted inside, homes of refuge for the terrified. Tear gas, water cannons, flashbang grenades and battlefield weapons are deployed each new day. An officer crouches, takes aim and shoots, making sport as he executes. From Yangon to Darwin and Mandalay, what am I if I look away? Frontline medics in the firing line. Caring for the injured is now a crime. Shot at in the street, tending broken bones. Stopped at gunpoint from treating bullet wounds. Hospitals vandalised, equipment taken, desecrated, in violation of the rules, of humanity, of the law. But don't be mistaken, we are keeping the score. From Yangon to Darwin and Mandalay, what am I if I look away? The street cannot easily be silenced. The people of Myanmar will not be sentenced to a servile future beneath the junta. In their own hands, they write this new chapter. The children stamp on the general's face, stenciled on roads and alleyways. Digital technology is spilling the beans. We know who you are and what it means. From Yangon to Darwin and Mandalay, what am I if I look away?
Wow. Incredibly powerful, Ben. Incredibly powerful, Ben. Ben, if I can turn to you now to make some comments, but I noticed that David Brennan has just asked me, has said that he's tried to put up his hand and failed. If other people are doing that, could you put messages to me in the chat? Because I can't see any, but let's carry on anyway with Ben, if we may, at this moment.
Thank you so much, Nigel. It's difficult to speak, isn't it, after that video? I just want to thank you for hosting this meeting and pay tribute to the people that we're collaborating with across the health partnership movement. I think Marcus has said it already, these are long-standing relationships, and so perhaps it isn't a surprise that so much activity is happening despite the challenges of coup. And we're very keen that we don't turn our back at this moment of challenge. In that spirit, we wrote to Dominic Raab, and a number of presidents of Royal Colleges signed a letter to him earlier in the year in February. And we received a very positive reply, which said the collaborative partnerships that you have established are a proven model for driving progress in global health. The letter talks about suspending all support which involves the Myanmar government, but it also went on to say the UK Partnerships for Health Systems programme will not be affected by the above mentioned suspension. We are content with the actions THET are taking to ensure the programme does not direct any support to the military regime. So we have that sense of optimism that the FCO do want to carry on and engage. Not everything is about money, but nevertheless, FCDO support is an important ingredient. What we don't have, I'm afraid to say, is any specifics. And that's perhaps to do with that context that you mentioned, Nigel, which is the doubts hanging over UK aid. But we really need help, I think, now moving from what is a very clear commitment and promise towards a more specific understanding of what support FCDO will provide.
Thank you for that, Ben. I'd like to go away from the meeting with a sort of clear sense of 2 or 3 things that I and others might be wanting to say to FCDO. So there's something here, isn't there, about getting clarity on what's just been said and the commitment to those partnerships. There's the point about the internet. There's the point about medical neutrality, which Marcus made so powerfully. And then there's the other issue of just raising awareness. But maybe if in the last 15 minutes people want to address any of those points or what they want from parliamentarians. There've been a number of parliamentarians at this meeting. There still are a number of parliamentarians at this meeting. You can't always recognise them because they don't say Lord or Lady or MP at the end of their name. But there's also been a number of others who said they want to know what comes from this meeting. So I think it will be very useful to get that ask really, really clear. But let me, at that note, turn to David Brenner, who I see was trying to come in. And if there are other people, as I said, who are having difficulty raising their hand, could you put something in the chat and I'll call on you? Thank you. So David, over to you for the moment.
Oh, thank you very much, Nigel. Thanks for organizing this really brilliant meeting. My concern, or basically I was listening in first to what Professor Solveig Sol was saying and highlighting throughout the importance of the border areas, really. The importance now, the importance as they've always been for providing medical support for communities in the very conflict-ridden, war-torn ethnic community areas in Myanmar. And we know that there have been parallel non-state support systems, infrastructures there for a long time. And they've always, or for a long time, also been dependent in many ways on donor funding. For instance, the Metau Clinic by Dr. Cynthia Maung and others, many of you will know, of course. In 2011, with the reforms, much donor funding has shifted to what's called inside Burma, of course. And as Marcus Wootton was saying also, of course, much of this really filled a critical void inside Burma. So as opposed to just now, and of course, that's the difficult question at the moment of aid cuts, etc. But still, how can we make sure that both the attention will be again placed at both places here, and especially also in these border areas, that many of those initiatives have been kind of left abandoned in some ways, since or for the last decade of reforms, actually. And we see how important they are now, not only for the humanitarian purposes in these areas, but also, as was raised before, for instance, for COVID control measures. I mean, these are the borders where there's human flows, etc., right? So it's in all forms of interests, I think, there. Thank you very much.
Thank you, David, for that. I can't see any other hands and I can't see any messages in chat. So Ben, I'm going to come back to you actually, and maybe you and I can just have a little bit of dialogue around this point about what we should be doing from here. And then I'm going to give the final word, of course, to the Minister himself at the end. So Ben, would you be wanting us to be making representations to FCDO about specifically clarification of what this funding commitment made, which seemed like quite a wide and open-ended commitment to me from the way it was said, picking up the point about the internet and picking up the point about medical neutrality, and maybe also just David's last point here, of course, about that this is in a wider context, but also, of course, saying that there is this extraordinary set of links that we have between our two countries. I see Sue Lwin does want to come in. The hand's obviously working. I think that is a hand. So perhaps just before you reply to that, Ben, let's get Sue in. Sue, over to you.
Thank you so much, Nigel, and to everybody who's tuned in on this very important meeting. Very briefly, I am a Burmese dermatology trainee at Guy's and St. Thomas's in London. I have the privilege to be here without, I'm not sure whether I'm frozen or whether you can hear.
I can hear you fine.
Yes, sorry. Essentially, just touching on what it is that we, the Burmese people, want, and what it is that we ought to be actioning in a coordinated international fashion. Just hearing, looking through the chats as well from my Burmese fellow countrymen as well, that, in solidarity with Professor Solveig Sol and Dr. Thin Lai, we really, truly need the killings to be stopped immediately. And through immediate engagement with the National Unity Government, to provide humanitarian assistance, as well as to recognize them as legitimate government, will be something that can be done effective immediately. I just want to make that point. Thank you.
No, thank you for that. Thank you for that. I do understand that point, and maybe that is a sort of wider issue, of course, but mustn't be neglected. Even though we're concentrating on the immediate practicalities, well, the immediate medical practicalities, but the bigger issue, I absolutely get that point. Ben, over to you. I think I don't see any other hands up at the moment. Ben.
So I think the point about use of UK aid is really important. So I'm going to linger on that for a moment. We're at a very difficult juncture where we're seeing cuts to UK aid, and that includes, by the way, a £7 million programme, which was called the UK Partnerships for Health Partnerships Fund, and that has already been cut. And so it's difficult to see where the FCDO will find the space to be able to support and use UK aid effectively to support these partnerships going forward. So parliamentarians' help getting clarity on that question is really important. And I think we've seen the value of that in terms of the good use that could be made of UK aid to foster these links and to provide very urgent sharing of expertise at this time of crisis. So I think there's a really clear, compelling story to tell about the ways in which we are sharing expertise that is much needed at this time, as well as a longer term story about the relationship between the Myanmar and UK health community. So I think the advocacy points around the funding from FCDO and getting clarity on what that would look like is really important. I think there is also this need to document the violence against health workers. So we have been working with Amnesty, with ICRC and others to make sure these acts of violence are documented. And I think it's terribly important that the international community shows the military that we are watching, the world is watching. And at some point, those case studies will be prominent in future tribunals, in future international criminal proceedings. And we as a community are working to help document those acts of violence. And if parliamentarians ever want access to examples, grim examples as they are, then we can provide that alongside other briefings. And then I think that that you mentioned right at the beginning, Nigel, and Marcus reiterated the importance of internet connectivity. So there is something about needing to maintain the lines of communication. And what's interesting is that the internet is provided by countries like the Dutch. So it's some of our closest allies who are providing the internet connectivity. And we would ask the government to use their influence on those countries to help ensure that connectivity continues. I have to say, if I may, as a final point, that it's a deliberate choice to invite Professor Zawe So to speak on behalf of the National Unity Government. The National Unity Government has a health strategy, as Professor has said, and it has a vision of an inclusive society where everyone will get access to health, and health at a time of great peril, as my colleague Thin Huang emphasized, with the COVID epidemic running uncontrolled in the country. And so I'm very grateful to Professor Zawe So for the leadership and the insight he provides. And it is that leadership and insight that will guide our actions as we go forward. Thank you so much, Nigel, for inviting me to share those thoughts. I hope they're useful.
Thank you very much indeed, Ben. I think you've given us an agenda, and I need to consult with colleagues coming away from this meeting. I've written down 5 points: the FCDO, money and support, the violence, and reminding people the world is watching. And we do know that it may take a long time, but the world is watching and retribution will come. The internet community connectivity point, the medical neutrality point, that was made, and then the overarching big issue of recognition and the vision and values of the national government. I'm going to hand back now to the Minister. Can I just, before doing so, say that, you know, these are such deep and impressive and depressing stories that we're hearing. I notice a number of numbers that I've picked up. 85 days, the minister says, since the coup. 750 people from Myanmar in the NHS diaspora. That is a big number that I suspect most politicians and people in the NHS don't know. 1,000 web users for Marcus Wooten's website. That's a lot of people to be supporting and so on. I also thank everyone who's joined this meeting, even if you haven't had a chance to speak. The chat line will be open for a bit longer. If you want to put your contribution in there, we will still be looking at that and thinking about what to do with that. We've got participation from all over the world. I just noticed a friend of mine, Russ Andrews, from a professor of neurosurgery from California, is on the call. So good to see you very early in the morning, Russ. I know that you are doing a lot in the US to generate action and activity and protest and to try and change the political dynamic around this. And I know everyone on this call is seeking to do that. And I hope we all gain some strength and solidarity from this call. But most importantly, of course, I hope for our Myanmar friends that you know we're supporting you. Let me on that note then turn back, and one other thank you. Thank you to Nicole Vatruba, who's been organizing this behind the scenes, and Ben and his colleagues for setting up a lot of the mechanics as well. But on that note, let me hand back to the Minister for the final sort of 4 or 5 minutes. So Minister, over to you.
Thank you so much, Lord Cripps, and then all the lords, ladies, and member of the parliamentarian, and all the participants, also that representative from that, and also Myanmar diaspora, and then all these attendees in this event. Actually, it makes us strong. And I would like to mention, actually, I myself is your product. I'm a member of the Royal College of Surgeon Physician of the Glasgow. Actually, I'm a state scholar, and I worked in Scotland for 2 years. And then I back to Myanmar in 2000. And then I have been working in Myanmar since 2000. And actually, I work for all the people. Actually, I'm a doctor for Dr. Aung San Suu Kyi. Actually, I operated her. And then also, I'm a doctor of the military senior general. Actually, their family, and I'm a family doctor of the most senior general of the military juncture. And then also I operated their family. And then because I'm an orthopedic surgeon and I'm spine surgeon, I operated and also May Online, wife of May Online, also my patient. Actually, I'm human. Actually, I'm not a politician, but in this occasion, in this event, and then in this changes, I have to stand on the right side, where for the people, and then right for the people, right for the country. That's why I have to stand on this side. Actually, immediately after the coup, they call me on phone, and then to join them. Actually, they offer me a senior and then also chair of the Yangon region. I refused. I mean, I have to be very cleverly refused, and then taking the risk and then all these things. And actually, because of the parliamentarian and then lords and ladies, I would like to let you know, this is a very important point. Actually, they are pushing us to have a more killing in Myanmar. You understand that? They are shooting to the head, and then also they are oppressing, and then they are still, killing and then arresting all these people, meaning they are pushing us to the bad things in Myanmar. We have experience in 1988, young people, they, fought against to them because they are very powerful and very strong. Almost second largest military in the Saudi Asia. You can imagine, actually they can manage and they can kill us and then they can fight us very easily. That's why they are pushing us to have, in Myanmar, to have civil war. If there's a civil war, they can manage. That's what they are doing. What I would like you to request is not only humanitarian aid, not only medical care, but also stop them to be happen Myanmar to civil war and face it. That's what they are doing. That's why, please, not only medicine, but also other things that you need to help us. Safe healthcare provider, safe nurses, safe doctors, and safe Myanmar. Thank you so much. Thank you.
Thank you so much. I think we all hear very clearly what you're saying, and as we've said, we stand with you, and I hope that we will be able to follow this up in some good and appropriate way. And perhaps we should finish with the salute, should we? Yeah.
We must win. A year of our army.
And we will look forward to.
Thank you so much.
Thank you all very much indeed. Thank you.